the ICTS Steering Committee meeting. For the rest of the group, I just want to give you a little introduction to Dr. Lincoln. She is a professor of environmental and occupational health and director of the Center for Environmental Health Disparities Research in the Program for Public Health at UCI. Her work highlights societal and social factors that contribute to health disparities. In addition to her many peer-reviewed publications, Dr. Lincoln disseminates her work through prominent news and media outlets and works to impact policy by sharing her expertise with the legislative branch of local and federal government. Her background is in social work and sociology, and among other contributions, her work has identified negative interaction as a particularly important risk factor for mental health among vulnerable populations. So we've asked Dr. Lincoln to come speak to us as part of our DEI speaker series. And we haven't really put any particular expectations on what she'd like to talk to us about, but I'm hoping to hear from her about maybe some of her own work, as well as perhaps some of her work with the program in public health in the DEI space.
Very good. Well, thank you, Dr. Snyder, for that introduction. And I appreciate the latitude, quite frankly, in terms of what to talk about. So I'm going to share my screen quickly because I want to respect the time and the format. And I'm hoping to be able to talk a little bit about the topic at hand by talking more about my work, because I think my work is focused mostly on Black Americans and health disparities. I'm a health disparities researcher. I focus on mental health as well. And I think that highlighting community outreach and education is very important, always has been, but I'm also want to talk a little bit about diversity, and I'm a critic of diversity and equity and inclusion, and I think there's room for all voices. And so I want to talk a little bit about my perspective and my approach to the work that I do. And so I was asked initially to address the first bullet point, and that was why it's so important to take into consideration the impact of race when we're engaged in health-oriented research in community contexts. And then I think yesterday or this morning, I woke up and there were some other forms of guidance with respect to what I should talk about today. The first, that this format is focused on the speakers sharing their perspectives about DEI and how we might shift the culture to increase our understanding, appreciation of DEI in our research and where we work. And then to talk a little bit about my involvement in the DEI planning in public health. So I can start with the last, in that my involvement was very minimal. I joined UCI in January, and I received a version of the DEI plan and was asked to review and comment based on my role as the director of CEDAR, the Center for Environmental Health Disparities Research. I did that, and I had a lot of how. And I always do. So I am true to being a sociologist. We're very critical, and we're looking for those connections, right? So this is where we are, this is where we like to be, and how do we get there? What are the mechanisms whereby we get from A to B, and how do we know that we got there, and who decides? And so my work is sort of making those same connections, coming to UCI from a school of social work, being trained as a social worker and a sociologist in a very interdisciplinary context at Michigan, coming to not just public health, of which makes sense to me because I've published and worked with colleagues in public health and was trained by colleagues in public health, but also coming to environmental health and occupational health. You know, what's my role? And so being able to make those connections, I think, is one of the contributions that I have to the field. And so with that, I just want to move into talking a little bit about diversity before we move on to me sharing some of the work that I do and my approach to the work that I do. So I'm sharing this this is a textbook written by colleagues of mine, and I was asked to contribute the very last chapter, which was a sort of final analysis of the conversations that were happening in this book, that were looking at diversity across religion and gender and skin tone, and race and ethnicity and different sort of aspects of religion. And so I had the benefit of reading all of these chapters and then being able to write sort of a concluding remarks in terms of the analysis. And so what I'm going to do is just read just a little bit about what I wrote in my chapter. Again, it's chapter 18. You see the title there. And so I started off with a quote from Audre Lorde. I love Audre Lorde. And so I'll just start there. For the master's tools will never dismantle the master's house. They may allow us temporarily to beat him in his own game, but they will never enable us to bring about genuine change. And the fact is only threatening to those women who still define the master's house as their only source of support. And so that's the quote that I started off this chapter with. And then I'll just read the first paragraph of what I wrote. And this is my own experience. So I'm speaking about myself. I was a brand new assistant professor at my new institution. The university had a tradition of taking newly minted faculty on a bus tour across the state. The president of the university joined us. 5 days on a bus, visiting carefully selected sites across the state, majestic waterfalls, ominous rainforests, a grand lodge surrounded by wild horses, an apple orchard featuring apples from around the world, a migrant farmer's camp with housing made from shipping containers, a Boeing factory the size of a small city with 30,000 employees and its own fire department. One night at dinner, the conversation shifted to diversity. There was a sense of pride by the administration in what they had accomplished, bringing together faculty from different disciplines, fields, and interests. Each new faculty member raised their hand and identified their own source of diversity and expressed their excitement and gratitude for being included in such a diverse group of new faculty and diverse institution, clearly the most diversity many had ever experienced. I listened as each person spoke. I waited. Surely someone else could see what I saw. Finally, I raised my hand. Look around the room, I said. Heads turned. What do you see? I asked. Puzzled expressions. What don't you see? More confused faces. Can no one see that I'm the only African American in the room? No one saw it. Do you all want diversity? I mean, really want it? I asked. We can have it if we all really wanted it, but I don't think we do. Silence, the typical response from members of the dominant group when a member of a minority group transitions the conversation from one that simply dances on the surface of something that we are supposed to value to one that delves beneath to a deeper, more complicated truth that requires significant change, undoing, and transformation. So that's how I began that chapter. And then I went on to talk about the history of diversity, how the term in and of itself, the definition has changed since the 14th century, how it's rooted in this country in law, right? Quantifying numbers, et cetera, and how we really need to think about how we came to the definition of diversity and, how people have very different ideas about it. And so I wanted to just end there. I mean, we can sort of pick this up later in terms of how we really understand it, the different meanings that it has to different people, who defines it, and how we can really get our heads around how do we achieve it, if it is a goal or a destination. And that includes conversations around equity and inclusion. And so with that, I wanted to share my guiding research questions. They're not sort of the way we typically think about it, but it's the way that I approach my work. And one of the questions I have to ask myself is, what is the role of science for improving the health and well-being of Black Americans? And so this is an important question to me because it goes beyond sort of research for research's sake, right? So am I engaged in this work to further my career? Is it for publications, for grants? Why am I doing this work? And I think we all have to ask ourselves, why are we doing this? To what end, right? And then the second is my research meaningful to the communities that I serve? That's really important to me, that there is meaning, not just for me, but for the people that I'm doing this work in service of. And then finally, how can I ensure that study participants have a positive experience? That doesn't seem to have anything to do with the other two questions, but it really does, right? It really helps us to understand what does it mean to engage communities. And for me, no matter how we do it and what we're focused on, the priority is that every single person that's engaged in this work with me has a positive experience. And it really does help with recruitment, retention, and really sort of thinking about the meaningful work that we're doing and its impact on communities. So I'm gonna just leave this here. This is from the website, from the Black Thriving Initiative. And this is what drew me here to UCI after being at University of Southern California for 15 years. And it's a wonderful statement. It really does sort of capture the goal, one of the goals of the BTI, the Black Thriving Initiative. And it talks about not only refuting anti-Blackness and sort of harnessing and leveraging the resources of the community, but what the ultimate goals are, to promote innovative public policy solutions to structural racism and yield practical benefits to Black communities locally, regionally, and nationally. And that's sort of defines the kind of work that I'd like to do and hope to think that I do. But again, this is something that really captured my attention and drew me here versus the other opportunities that I had. And so I want to really quickly go through some of the work that I do and how I do this work. But because of the ICTS and my previous role as co-director of the Community Engagement Core at the CTSI at USC, community outreach is very important. We know that. We know that community outreach and engagement are the two most effective ways to engage and recruit minoritized community members for research. And we also know that research registries have been identified as one of the most effective strategies for including members of minoritized communities in research. We also know that there are barriers and facilitators to participating in research by these same communities. However, I think it's really important for us to know, many of us do know this, and I just want to reiterate that despite these barriers and BIPOC communities, communities of color, have identified more barriers and higher levels of fear in terms of participating in research than whites, but are still willing to participate. So I think that's really important. Tuskegee has absolutely nothing to do with it, right? We hear about this all the time. It's not related to African Americans in particular attitudes around participation. The biggest problem that we have is that they're not asked, right? And so I think that's really key. And in my work in communities, we're oftentimes the first time that people have participated in research because people, as they say, they just don't come here, right? So I think it's really important for us to think about how we're recruiting, where we're recruiting, and what is the ask. And I'll share a little bit about our strategies for that. So this is fully accessible. It's a systematic review. And the reason that I'm including it here in this conversation is because this systematic review identified a number of barriers to participating and facilitators to participating in health-related research. And so you see mistrust is at the top. And then, of course, if you go down the column, there are some other barriers that have been identified in this systematic review. But I also want to highlight this, that when we talk about mistrust, it is something that is an issue or concern across multiple racial and ethnic groups, but it's different, right? So in general, the concept of mistrust is qualitatively different, depending on the group that we're talking about. And this is one of the things that we have to consider is the definition of terms. When we say mistrust, when we say race, or ethnicity or culture or minoritized populations, what exactly are we talking about, right? How are we conceptualizing that? Is there agreement? Are we thinking about different things when we're using this terminology? And so this is an example of if you say mistrust, yes, it does exist across communities, but it means different things. And we have to understand what it means in order for us to address those concerns. So I found this in my own work. I did a series of focus groups, particularly interested in what were some of the issues and barriers and facilitators around African Americans' participation in Alzheimer's disease research. And so I found pretty much the same things that have been reported in other publications. The thing that I want to highlight here is that even when you unpack unequal treatment, you can look and see how some of the African Americans in this study were sort of talking about that. And some of it has to do with, people feeling like they're not valued and there's just a lack of concern for their well-being. Cultural trauma was endorsed and talking about some historical events like Tuskegee and Henrietta Lacks, but also talking about the things that happened to them yesterday at the hospital, right? Some very contemporary kinds of issues and experiences that they themselves experienced or other people that they knew. And then racial identity and cultural norms, I do want to highlight that because if you understand culture, right, which is really important, particularly with African Americans, Black Americans, religion, yes, is part of that, but there are these cultural beliefs around sharing information with strangers, right? And so if you're participating in research and you're being asked to share information with people that you don't know, it is sort of a taboo, sort of breaking a cultural norm. So we have to understand, how do we get around that, right? So I want to talk about the butterfly effect, right? So part of what I do, they're small things, but they can lead to really big changes in how we engage in research. And so just these small little details that we do in the work in the community really does have a big effect. And I think, collectively, we can really change the culture and change the way we engage in research by making these small changes. So I'll start just really quickly talking about advocates for African American elders. I started this health promotion, health education advocacy group when I came to Los Angeles, working primarily in South communities and engaged these people. And in the gold, you'll see that they're representing many different governmental and community-based organizations in LA County. And so these are some of the areas that I went into. And so I'm sharing this because this was the first thing that I did when I got money from the California Wellness Foundation to start this program. I did a survey because I'm a trained survey researcher and I wanted to get a sense of, well, what are some of the concerns in the community. And this particular survey came about because I learned that services for older adults in communities were primarily determined by those who were providing them, but the people who were receiving them were never asked. And so I asked them. And so the goal was to enroll 200 African Americans 50 and older in about 6 months. And I ended up having 550 respondents in about 4.5 months across these different communities. I use the racial dot map, which helps me identify where African Americans are densely populated. So the green represents African Americans, orange, Latino, blue, white, red, Asian. And so I was able to go to different communities to get a cross-section of African Americans. We need to have these heterogeneous populations to really get an understanding of the differences. Even though the entire sample is African American, the experiences and access to resources and health profiles, et cetera, are very different depending on where people live. These are some of the outcomes, key findings. I asked a lot of questions. I focused on this one initially because there was a very important healthcare transition that was happening in LA County with Cal MediConnect. And a lot of research or a lot of outreach had been done in some communities, but when we saw this number, we realized that African Americans had not received this kind of information and education and outreach that they needed in order to make a decision about whether they wanted to participate in this experiment. And so when I saw this number, I was quite alarmed because I was concerned that people would have major healthcare disruptions if they weren't aware that they needed to do something to opt out. Otherwise, they would be passively enrolled into this experiment and it can completely change the way that they receive their healthcare. And so we decided to do our own outreach. And so we have flyers that were appealing to African Americans in these communities. And we use talk shows because talk shows are easier and they're less academic. And so we created this format where we had talk shows. We had a host, we had guests. There were PowerPoint slides. We didn't really rely on them much. We just sort of highlighted pieces of information that we wanted people to know. And here's the audience. And so there's the set. We still do this in many different neighborhoods so that people can learn about really important, complicated issues in a really relaxing, engaging format. These are some of the ways that we disseminate information. The piece on the left was a piece we were asked to contribute to by Justice and Aging. They started to work with us on these talk shows and found that it was a really good way of engaging hard to reach or hardly reached populations. And so they asked us to do this piece to share information about how we do it. And then the piece on the right came from the data from the community survey. I wrote a piece about community-based programs for older adults in LA County, and it got picked up by the state legislature. And so that led to me testifying to the state legislature about the importance of community-based programs, quality community-based programs in neighborhoods to help older adults stay in their homes. And then I was appointed by the governor and Kevin DeLeon to different task force to talk about health equity and aging equity and diversity, equity and inclusion, and building that into some of the plans to serve our older adults. And so BrainWorks quickly was a way of me addressing some of the concerns that were being raised with the population that we're serving around Alzheimer's. And getting calls about memory loss, concerns about memory loss, trying to find homes and sort of economic crises that were happening with people who were sort of finding out late that they were having memory loss or a loved one was having memory loss and they didn't know what to do. So I responded to that by creating an Alzheimer's disease education intervention called BrainWorks. And I basically wanted to increase Alzheimer's disease literacy among African Americans. It had never been done before, but we know that if people have higher levels of literacy, particularly with Alzheimer's, they can recognize the symptoms, they'll seek help, and then they'll engage in cognitive testing. And so that led to BrainWorks. We were able to enroll over 200 participants in less than 2 months. Here's some of the findings from that work. And this is key on the left. After we finish this study, this intervention, we invite everyone back. Anytime we have a study, we invite every participant back to share our findings before we share it with anyone else. So this was a brunch we had. And then the second is an infographic that we created to share findings in a very easy way. It was also shared on USC News, and then there's the peer review journal that's more geared toward the scientific community. And basically we found that if you use culturally tailored methods to share information and educate African Americans, that the levels of literacy are actually higher than using other ways of delivering information. We also have a YouTube video, which is accessible. This is other ways that I share and disseminate information, op-eds in the New York Times and Wall Street Journal, to talk about some of the issues that are of concern that have come out of the work that we've done in communities, and being able to share that information to lay audiences to sort of raise awareness about disparities. These are some of the communities, again, using the racial dot map to identify where African Americans are located. This is from the 2020 census to get a sense of where to target some of the work that we're doing. And then really quickly, these are members of my team that do this work in the community. I actually asked a couple of them to be featured in articles that I was asked to participate in. And so you'll see them here. Ms. Mardell, who works with us, was featured in CNN and Kaiser Health News, and then Ms. Mardell, Ms. Maxine was featured in LA Times, and this went worldwide about some issues that we're really concerned about. This just shows you that we don't really do anything different than most people do with respect to outreach and engagement. These are just flyers, and we always have food. It's really important to have that. on the left bottom is a video that we use because we don't ask anyone to do anything that we don't do ourselves. And so on the left, it's an actual video, because we're collecting blood. And so this is Ms. Mardell again, and my program project manager collecting blood. And we show this to participants so they can see that we're not asking them to do anything that we don't do ourselves. These are pictures. It's important for me to talk to and interact with every single person that comes to every single information session that we have. It's key so that they can see you and talk to you. And we usually have about 90 to 100% participation and enrollment in all of our studies as a result of the methods that we use. These are recruitment sites. So we have 2 studies, one just finished and one we have 3 more people that we're enrolling, and I'll share really quickly what those studies are. But these are some of the sites that we go to. There's 2 churches at the top, but for the most part, we don't go to churches. We don't recruit from churches. We recruit from many different sites, but they're usually, large sites where community African Americans are gathered and congregate. And I can talk more about that later if we have time. So really quickly, we're asking for imaging and we're asking for blood, but we don't start out that way. There's a process by which we are able to get to this ask. And a lot of it is outreach and a lot of it is education around, why we're doing this work and what the benefits might be for the study participants. So in terms of translation, we go from these are studies, mouse models. This particular study is focused on the role of sleep and cognitive impairment. And that's exactly what we're doing, but we're doing it with humans, right? And so this is how we translate these kinds of studies that are done in labs to people. And so this is the study that we are wrapping up now. Again, we have 3 more participants, and then we'll be finished with this study, trying to understand how poor sleep quality is related to cognitive impairment via the perivascular space, right? And so we have imaging and actigraphy and surveys, et cetera, in order to get that information. And these are exclusively African-American participants. And then here's another study that we just wrapped up, trying to understand the accelerated aging process and how stress, particularly racial discrimination, leads to accelerated aging in African-Americans. And so we just wrapped up this study last week, actually, using methods that include survey research. We're also collecting blood using the Tasso device, which uses puncture. It's less painful, and our participants actually wanted this type of sample collection versus a phlebotomist or any other method. And so we're trying to understand how racial discrimination basically accelerates the aging process among African Americans. We're using the cultural mistrust inventory, and I just want to share this because it's really important that we, instead of assuming that there's mistrust, that we actually measure it, and we do in all of our studies. And we always ask after the fact, is there anything that we could have done better, right? So it's really important for people to be able to weigh in terms of their experience, because to us, that's key for them to be able to come and have a good experience and share that experience with others. And that's really how we're able to maintain our participants and increase our participant pool if they have a really good experience and they learn something. And so finally, this is just some of the information that we share with participants in terms of the benefits of participating. And so for our brain imaging study that we call Sleep Tight, they actually get a copy of the scan right after they finish their scan on a CD-ROM. The sleep study, they get a copy of their sleep report as soon as they hand the device back to us. And so they have the data in their hands. And so questions about what are you going to do with this and who's going to see it, they do come up. We're able to answer those questions, but we also are able to share the data with them so that they actually have it. So there's less concern about what's going to happen with their data because they in fact own the data. And so I just wanted to share that really quickly to give you a sense of how we're doing the work that we're doing, why we're doing the work that we're doing, and some of the methods that we use to do that.
Thank you. This is very impressive, actually. so I was interested in one aspect. I mean, I'm interested in many aspects of what you talked about, but I'm a geneticist, and the issue of privacy is coming more and more. And in particular, there are more and more mandates from funders, especially federal funders, for complete sharing of everything. So basically, for genomic studies, you basically cannot get federal funds from NGRI if you don't include a general research use in all your consents. I mean, that's becoming the reality, at least for the National Human Genome Research Institute. And which means that all data is going to be readily available publicly, that even samples can be shared without additional consent. So there is no control on the samples. And I was interested in, you made a brief allusion to, some cultural maybe beliefs or issues, but it's not my type of research, but I've noticed that in my when I was consenting families, that there are certainly differences based on culture and race and ethnicity. And as you were talking, I was Googling a little bit, and there are papers that say, hey, there are some there is an increased sort of skepticism about from the Black community about sharing everything without any control. And I mean, if that's the case, I mean, that's how, I don't know, what can we do about that? I mean, it's really the trend, and on the other hand, it's it almost creates an additional obstacle, and it really doesn't have to. But is it we don't educate enough? I don't know.
Yeah, well, I appreciate the question and the comment, and I understand the concern. And again, I think there are a number of barriers that have been identified. I don't think there's anything we don't know, quite frankly.
Mm-hmm.
But you can get around every single one of them. They're just not barriers.
Right.
I think being able to have teams that include people who understand how to do that is key,
Mm-hmm.
so that you're not surprised.
Mm-hmm.
Methods, even though we have an understanding of the communities that we're working with, we don't know everything. And so there are conversations that we have before we even choose a method, before we chose the TASL device after many conversations with our community partners around, what would be acceptable. Having research informants who have worked with us for years, who we ask, is this acceptable? Would you use this? Right.
Mm-hmm.
And it's not the same for everyone. For some, it's like, for these people, maybe yes, for these people, maybe no. But to be open to the fact that, having something that's universal is difficult. Is everyone going to say yes? No. And so when we go out and do the work that we do, these informational sessions, we don't go out with the assumption that we're going to enroll X number of people. We go out with the intent of educating people, so that regardless of whether they want to participate or not, they leave armed with information about how to take care of their health, reduce their risk, increase their brain health, lower their blood pressure, lower their risk for diabetes, manage their chronic health conditions. And we always have space available. And if you want to participate, you can go over there, right?
Yeah, no, this is great.
And that's really key, is that we go with open hands to share information, because, we're often asking for other people to share information. And so yeah, I think it's the way you do it.
Mm-hmm.
That really opens up people when you're honest and authentic, and you answer questions, and you don't go just for that. it creates a very different environment in terms of what people are willing to share. And so that barrier, yes, it has been identified as a barrier. We don't experience that in the work that we're doing.
That's great advice. Dan, you had your digital hand briefly up and then down.
Yeah, I'm just worried about the time. But a quick question. First of all, thank you, Dr. Lincoln. Really appreciate your talk. It just, a lot of it parallels the challenges you face as we do when we work with children. And a lot of the issues of communication, et cetera, et cetera. I'm not as sanguine as you are about your ability to solve all these problems. And I think to Eric's question, I don't think it's just the African-American community that's worried about the ubiquitous sharing of data. I think a lot of people are worried about what happens to their data in a research project, but you know, that's a kind of a separate topic. And then I may not be as good as you guys are in getting people to agree. That's quite possible. But my question is this: we've set up a group of early career faculty, minoritized, who, and we want to address the issues that you began your discussion with about DEI. And I was intrigued when you said you're a critic of DEI, but that'll probably be a different discussion. But I'd like your thoughts on the following. One of the issues we talked about was the minority tax that occurs so frequently, and it's a bigger problem, which is what do you mean by service in general for anyone, for any faculty member? So I'd like your opinion on this. And I've done some literature searching, and some universities have kind of gotten into this, but would it be a worthwhile effort for a group like ours, the CTSA, to help come up with some roadmaps about, in general, what good university service is, and more specifically, what DEI service would be that would be meaningful and not just, you know, I hate to use the phrase, but virtue signaling, you know, I went to 5 meetings and something like that, because it's really time to move beyond identifying the problem and solving the problem. I think it's time to start, and I'm sure you agree, solving the problem. I'd love your thoughts on that.
Yeah, so I appreciate the question around service. And, you know, I think that, I think just like with DEI, that needs to be operationalized. And so I'm real clear about what my service entails. It doesn't preclude me from, you know, I'm currently vice chair of the Behavioral and Social Sciences section of the Gerontological Society of America, right? And I've done lots of professional service over in my career, and also within community. So I think, you know, as a CTS or a member of the CTSA community, you know, what does service look like? We have service that is counted for tenure. We have service that's counted toward our career. And then we have other service that may be meaningful, but may not count. And they compete oftentimes with, you know, for our time. And so, you know, having conversations, and maybe it's a policy issue, you know, how do we define service? You know, are we inclusive of that? Are we able to operationalize that in ways that it all counts? So that it's not competing, so that we don't have to choose this because it will advance my career and count toward tenure, or this because it's what I'm wedded to and what, you know, I'm passionate about. And so, yeah, I think, you know, having larger conversations around how we define service and how that will support the mission and goals of the institute, of the center, and of the scholar, and of the community. I think that's, you know, it's ripe for conversation. And with respect to, I'm sorry, your second question around diversity, equity, and inclusion, how we move forward, how we move beyond that.
What are meaningful activities?
Yeah, I think, and when I say I'm a critic because of how, you know, DEI has been defined based on, you know, like essentialist notions. You can count people. If you have enough, you know, how do we know whether we got there or not? We're sort of counting the numbers as they go up and down. but not really sort of taking into account like what does it really mean in terms of diverse perspectives and experiences, and how we can reach a point of inclusion where people feel like they belong and, you know, they can contribute and that they're valued. And so having a definition of not only DEI, I cannot frame that for anybody, but what's your goal? What are you trying to do? You know, do you want to increase the number of underrepresented minoritized scholars? Well, that you just count people, right? Or is inclusion? I think inclusion is important because it's a feeling, right? And so those who can say I feel included are usually the people who are the ones who are being counted with respect to diversity. And so being able to move beyond that, I do think working with communities is really important. We know that. Being able to, I don't think that you have to be Black to work with Black people. But I do think that you need to have an understanding of communities. And so for me, being Black doesn't mean that I have an in. Right. So, I mean, it's a long answer to your question, in that I look at the heterogeneity within Black Americans. That's it. And it's very complicated, very, very complicated. And we tend to group Black people and say the Black community, and there are many communities. And there's a lot of differences, whether it's regional, whether people are born in this country or immigrant to this country, whether their English is their first language or not. I work with Black communities, and I think understanding the heterogeneity in that means that I have to be culturally competent as well, and responsive and humble. And so I think the way that I look at diversity within Black Americans is to understand that we are not a monolith. Nobody has the right answer, that diversity evolves, it changes. And we have to sort of understand, well, what does it mean now in this context? Post George Floyd, hopefully post COVID, but to understand that it's a very fluid definition, and it always has been. It always has been fluid. And so I think the biggest challenge for us is, what does it mean and who's defined it? You know, if you ask people, you know, that I work with, what does diversity mean? You're going to get very different answers. And I think that's the problem, is we really want to get there, but I don't think we know where there is. And I don't think we really know what we're talking about half the time. So I can't answer your question because no one can answer your question. And
well, I don't know what I'm talking about
90%
90% of the time. So
yeah.
I'm used to this. This is fine. Thank you so much, Dr. Lincoln.
You're welcome.
We may ask you to help us in that small group if we can.
No, I love that we're asking the question, because it speaks to intent.
Yeah.
And we have to be comfortable with the fact that we will not all agree.
Yeah.
Right. We're not all going to have the answer, because we're not trying to get at an answer. We're trying to do good work. Right. And we're trying to improve and optimize lives in context. If I can move everybody from this neighborhood and put them over there, it'd be great, because we know they're healthier over there, but we can't. So we have to figure out, you know, how do we optimize people's lives in context? And most people that I work with in communities, they can tell you, like, this would make my life better, right? This would make me feel better. And it's not often what we think it is. And so a lot of the clues I get are from asking the people, you know, how can I, you know, support you? How can I help you? And a lot of people really know what they need. We just have to ask them.
Great. This was great. Thank you so much. Any other comment? Okay. I think we do have actually maybe topically one item to discuss about community advisory board. So yeah, if so, and you're, if there is no more question, I just want to thank you again, Dr. Lincoln.
You're very welcome. Well,
for
thank you for the
time and
invitation, and I shall leave you to the rest of your business.